Our first guest speaker, and I would like to invite on an academic note. I have been in touch with Dr. Murad Moosa, who is a psychiatrist, who has passion for medical ethics, and which I share with him. And he is, as he has been introduced, he's the professor and chairman of the psychiatry department in AKUH University Hospital, and he speaks and represents the medical ethics scenario in various organizations and conferences. So I would like to invite Dr. Murad Moosa to come up to the stage and share his views. Dr. Murad Moosa.
Assalamu alaikum. I'd like to thank Dr. Zaki for accepting my request to present here. I'm not an invited speaker, I must tell you. When I saw the program, I felt this is a very good opportunity to talk about something that I very strongly believe in. And I wrote to Dr. Zaki, then I followed it up with a telephone call, and Dr. Zaki was gracious enough to accept my invitation. So thank you very much, Dr. Zaki. I'm going to talk on beyond quality and why healthcare organizations need and must invest in ethics. This conference is about quality in healthcare, and I appreciate that. But I want to make a case, and I want to argue why ethics is as important, if not more important than quality. So I'm going to talk a little bit about what are healthcare organizations, what is quality in healthcare, and I think all of you are coming from the background, as I understand, know about quality much more than I do. What is the difference, the essential but the subtle difference between quality and ethics? Are they exclusive? Are they complementary? What is the importance of ethics in the medical profession? And by that yardstick in healthcare organizations. What are the attributes of an ethical organization, be it a healthcare organization or a manufacturing organization or a service organization, and how do you make organizations ethical? So these are some of the areas that I would try and cover. Healthcare organizations evolved from hospitals, which itself evolved from the early Christian church. And because of their religious background, they had a very strong, compassionate view of the people who needed care. And the early healthcare was free. It was mainly directed towards the poor people, and it was free. And because of their early church background, healthcare organization and health was rooted very strongly in religious and philanthropic traditions. A lot of it that we see in Pakistan, many of these charitable hospitals that are run purely on donations and charity is a reflection of that. And so the focus on the ethical dimensions of healthcare was very strong because of the way healthcare organizations and hospitals evolved. Nowadays, in today's world, healthcare or hospitals have become very, very large conglomerates. Healthcare organizations are very large. They have huge budgets, millions of dollars. And because of this, because of the money that is involved, they have a lot of authority and influence. In the West, you have the health management organizations or the managed care organizations, the HMOs or the MCOs. We don't have HMOs in Pakistan yet, although I think we are going that way. But what we do have are private hospitals, small-sized private hospitals, large-sized hospitals, and medium-sized hospitals. We also need to remember very, very clearly that most healthcare in Pakistan is out of pocket. So people pay out of their pocket for healthcare. The government only picks a very small part of that budget. We know that the annual budget of healthcare in Pakistan is about 1% of the national budget. And we know that issues of governance, mismanagement, corruption eats away even that 1%. So the public sector healthcare industry or the healthcare sector only is accessed by the poorest of the poor in the society. Healthcare industry has become a very profitable industry now because of the money that is involved. And it is run on the principles of business. And in business, you have to have profits. You have to make profits. And one way to make profits is to have high turnover. To have high turnover, you have to have systems that are efficient and that cut wastage. So the more that you can produce in less time, the more you'll be able to sell, and therefore your profits will multiply. How do you make systems efficient so that you have more turnover? By introducing quality in them. And all of you from the business background or business schools would know that. And there are many different definitions of quality, but what it really means is that in quality you have to have a product which is free from defects, deficiencies, or significant variations, and that meets the customer or the user requirements. That is what quality is. And therefore the quality movement that started in the pre-World War II, but got a huge impetus because of the huge demands on production during the World War, the quality movement was born. It was then taken up by Japan as something to really inculcate in all aspects of their industry, and the concept of TQM, or the total quality management, was born. And after that, continuous quality improvement, the ISO, and so on has developed and has now become very well established. And so what started in the manufacturing industry moved out from there into service industry, education, government, and finally healthcare. And many of you might know of JACO, the Joint Commission on Accreditation of Healthcare Organization in the US, and its international arm, which is called the JCIA, the Joint Commission for International Accreditation. And AKUH, where I work, is now JCIA accredited hospital, and I think some other hospitals are also trying to get the JCIA accreditation. So it's a very important stamp of authority, of quality, that you've reached certain standards, that only then you will get this accreditation. So the good news is, as quality in healthcare has been developed and been inculcated, it has led to a lot of improvement in patient care. There's no doubt about that. Through improved documentation, through improved safety, through improved standards, it has also led to improvement in protection of doctors, because doctors are much more careful now, chances of mistakes are less, and therefore litigation against doctors is also kind of protected the more quality is there in healthcare. And overall, the healthcare systems have improved because of quality in healthcare. So that's the good news. What's the bad news? The bad news is that despite the billions and millions of dollars that has been spent worldwide, most healthcare, particularly in developing countries like Pakistan, is still very ineffective, very inefficient, and very inadequate. This is the bad news. And patients' complaints have grown. Despite the advancements in technology, litigation against physicians has grown. They've increased in the US as well as in Pakistan. And violence against healthcare professionals has increased. And this is a new phenomena. The extreme form of dissatisfaction against healthcare professionals is violence. And these kind of headlines are very common in Pakistan nowadays. So patient gets unwell or dies, and therefore the attendants get irate and they start attacking the doctors and other healthcare staff in the hospitals. This is very, very common. It's an everyday occurrence now that you read in the newspapers, and now television are also showing all these things. So what's wrong? If there was a quality revolution in healthcare, people should be more satisfied. But the opposite is happening. Why so? Because I believe, and many of us believe, that there is a missing link, and the missing link between quality and healthcare is ethics. So what is ethics? Ethics refers to a system of moral principles, a sense of right and wrong, goodness and badness of action, the motives and consequences of our action, but more importantly, ethics is about internalizing values. It is not about mechanical behavior, it is about internalizing values. And I'll expand on that a little bit more. The difference between quality and ethics, like I said, is subtle, but it's very important. Quality is about doing things in a certain way to get the desired results or to meet certain standards. That is what quality is. It is driven by directive and policy. You have a target to achieve, the defect should be less than 10%, and that's what you try and achieve that. But ethics is doing things because it is the right thing to do. Not because you're directed by a certain policy or a certain standard. It is driven by internalized value. And I'll give you an example that I've used in different presentations. Hospital-acquired infection is one of the most troublesome areas. Those of you who work in hospitals would know what hospital-acquired infection is. Patient goes in for elective surgery because the ward is running some sort of an infection problem. Patient gets an infection. Instead of staying for 2 days, he stays for about 6 days or 7 days. And one of the critical things that lead to hospital-acquired infection is the poor hand-washing techniques of the staff. So they go to one patient who is infected, they go to the next patient, they don't wash their hands, and therefore transfer the infection from one to the other patient. It leads to increased morbidity and mortality, it leads to increased length of stay, and obviously it will lead to increased costs of the care. Many hospitals have responded by putting hand-washing liquids and these kind of implements on the walls. So when you put this, you fulfill the quality requirement. But does it mean that your staff will start using that? And this is the essential difference between quality and ethics. Quality indicator will say that we need to bring down the infection rate by an X percentage. It could be, say, 15%, and then you go and do a quality audit. Ethical indicator will say that you have to wash your hands because it is the right thing to do, period. And you do that through what is called value-based training of your staff. Because it is unethical to expose patients to risk, which leads to increased mortality and morbidity, it leads to increased length of stay, which will lead to increased cost, and we do not inform patients that this hospital or this ward is running a very high infection rate. We admit them without really informing them. It's unethical to do so, and many hospitals are doing that. And so the industry is also waking up that unless you put ethics into quality, you cannot succeed. And business people from the manufacturing business industry are now waking up to this, and they are putting ethics into their systems. Because quality is always a byproduct of ethics, and not vice versa. If you only focus on quality, you will never get the desired result, and particularly in healthcare, this is where the great feeling is. The other thing I want to talk about is the core values of a profession, particularly the medical profession, and by that yardstick, the healthcare organization where the medical profession is practiced. Core values are enduring principles, are the fundamental beliefs that provide a compass, a roadmap in the direction a profession should move. It powerfully shapes organizations and professions as well as individuals. The core values of the medical profession are humaneness, compassion, caring, empathy, altruism, understanding, innovation, empathy, and ethics. These are some of the core values of the medical profession. Individuals who live out the core values become extremely powerful role models. And similarly, organizations that live out the core values become much more gratifying and satisfying place to work. But in today's world, unfortunately, medicine has become highly commercialized. It's become like a business. It's profit-driven. And this is an example of how medicine has been reduced to a business, where now we are advertising procedures blatantly on these huge billboards around the city. And so the business of medicine is now about customers and volumes and revenues and incentives and targets. It is not about compassion and caring. This is where medicine has moved. And patients have become commodities to be brought and sold, to be exchanged and bartered, and in the process, a lot of money is made. And the further medicine and healthcare organizations move away from the core values, in fact, any profession that moves away from its core values, and becomes like a business, or tries to become like a business, the faster will be its decay. And this is what you're seeing here, particularly in Pakistan. So it's extremely important for healthcare organizations to invest in ethics because it will improve their functioning. Who should be educated in ethics? Each and every person in a healthcare organization, from chief executive directors, managers, to your medical and nursing staff, as well as the support staff, each and every person. And every facet of a healthcare organization must be ethically driven, whether it's your clinical care, whether it's your policies, procedure systems, appointments, promotion, compensation benefit, and particularly the business model must be ethically driven, not profit driven. And how can you do that? By inculcating ethics training for your staff and monitoring that training by conducting not just quality audit, but also ethics audit. You do ethics appraisal of your staff. We do appraisal of your staff, but very rarely do we include ethics in that. And all of this can be done by establishing an office of ethics assurance, similarly like you have of quality assurance. So in summary, and my time is up, so this is my last slide, healthcare organizations need to invest in ethics because we deal with a very vulnerable and distressed population. People, when they're sick, are extremely vulnerable. Quality alone is insufficient to provide the kind of care that people require. And that is why complaints are growing. Ethics is fundamental to the medical and the nursing profession. And they have a critical role in healthcare organizations. And therefore, healthcare organizations that invest in ethics to complement the quality programs become successful. Thank you very much.